So we're going to have a conversation about Kyzatrex, which is an oral testosterone. It has a different method of delivery, which isn't through the digestive system. That goes through the lymphatic system, which we'll get into a little bit more. But it's supposed to be sort of like a revolutionary new way of getting testosterone without having to do the injection, the scar tissue, all of the rest of the things that come with that. At the beginning, one of the questions I had was, how long does it take for the product to start working? If I'm on an injectable right now, and then I start taking Kyzatrex, am I looking at a sort of a gap in between there where it's catching up because it's like a longer ester or something? What could you expect in the initial phases before you actually get used to it and your body has it in the system and it's going?
With that in particular, honestly, there shouldn't be any lag period because of, one, how well the absorption is, and then two, the half-life. It's a more of a short-acting ester, which has its benefits, especially when it comes to side effect profile wise. So, but that's something that you should definitely, if you're switching over from the injection, you should definitely notice right away. It's not something that you have to wait on. Within that day, the next day, you should definitely notice the benefits.
So you just hit the ground running. We don't have any period of time where you got a week or something lags in the process where my body's acclimating to the new testosterone.
No, since technically the half-life isn't super long, but that means it's just but the bioavailability is good enough that you're gonna notice the absorption that day.
If a person were to, how people, if I stop doing this, what am I going to experience? Now, I am assuming because the half-life is so short, it's going to be out of your system relatively quickly. Like, we're not going to have this lingering thing like some medications where you're looking at a week, 2 weeks. As it gets out of your system, you're still going to have some side effects. So this gets out of your system pretty fast too?
That is correct. Like I said, half-life isn't super long, so it only probably 2-3 days max, and it's going to be out of the system.
Now, how does Kyzatrex compare to injectable testosterone treatments in terms of effectiveness and maintaining consistent testosterone levels? And by that, I mean when we pick it toward like injectables or creams, other delivery methods, you could expect similar results from it, or is there a difference?
No, we're going to expect, honestly, probably better results because it's going to more naturally mimic your endogenous testosterone because, throughout the day, your levels are going to be peaking. When you do the injection, you get that high peak. And because it's a long-acting ester, it's going to stay in your system high for an extended period of time. And that's where we, unfortunately, get those unwanted side effects from. Because it's a short-acting ester, it's more going to mimic your natural testosterone production in a day. That's where we see less side effects, especially when it comes to decreasing LH and FSH. We don't get a high conversion rate of estradiol because it's not staying at such a high level for an extended period of time. And then it gives your body a chance to start producing LH and FSH again after, that in-between dosing periods.
Are there any types of other medications, like stripped by a doctor over the counter, that you can pair with Kyzatrex to make it more effective? Like certain times when we take a medication and we put something else with it, like I do tirzepatide, Mick put me on tesibenzine along with it, and it like puts rocket fuel behind it, right? So it elevates it. Is there anything with Kyzatrex that you stick in there with it and it kind of elevates the effectiveness?
So just like in other testosterone therapies, it can be done with enclomiphene or HCG as well, just to help improve your LH and FSH signal and to improve your endogenous testosterone. But it's not necessary, but it's something that, yes, can be done if you're looking to maybe preserve spermatogenesis in some patients, in particular for fertility reasons. You could probably do even a lower dose of the Kyzatrex, 200 milligrams, maybe 300 milligrams total a day with enclomiphene or HCG, but it's not necessary.
And another thing I'll add to that too is, there's two school of thoughts out there, but, a low dose DHEA also be a potential option there too, with a synergy with the Kyzatrex.
Understand it's a new product. I mean, well, a couple of years or so, you guys said that it was. I mean, it's probably been going on a lot longer than that. But it was FDA approval for 2 years. But how much data do you have? Clinical data would you have? And there may not be much that shows, the effectiveness and the benefits that it has in the long, and not necessarily long term, because you don't have that much data, but showing that there's no fall off. Your body doesn't acclimate to it, or it just consistently provides your body with the additional testosterone it needs without your body getting acclimated or used to it.
Yeah, well, I think we do see that in some even injectable testosterone, especially when you're talking about a decade, 2 decades of taking it. Sometimes patients do require higher dosing. Yeah, unfortunately, we don't have that long-term data on it, so I can't make a statement on that in particular. But at least on the safety and efficacy side, I mean, we do have, a couple years of data showing that it doesn't, it's not going to increase patients' blood pressure, while they're taking this. Is a concern sometimes with patients being added on testosterone. We just talked about LH and FSH earlier. We haven't seen that increased risk of erythrocytosis or polycythemia as well, while patients are doing the oral testosterone. So that's been a big plus on that side. So yeah, efficacy in the long-term studies haven't, unfortunately don't have that data, but on the safety side, we do have a decent amount of data.
What were some of the most common side effects associated with Kyzatrex? And again, how do they compare with the other things? Is there anything that you would get as a side effect with Kyzatrex that you wouldn't get with an injectable or a cream?
No, I think that's what I mean. The great part about it was there was less side effects. When it came to before so mentioned, decreased risk of erythrocytosis, polycythemia. We actually saw decreases in SHBG as well, so total, which would increase that free testosterone that we like to see. I know in the studies you'll see when they measured the dosing in particular, they did it at 12 hours apart. In practice, we see a lot of providers dosing it differently. So you'll do it with breakfast and then with lunch, one that helps you get to an even a higher, Cmax in particular. And in the studies, they like to kind of see the pharmacokinetics of it, how, you get a peak and troughs. But I think more in clinical practice, we like, because like if you're going to take it 8 hours apart, you take it 8 in the morning and they take it at bedtime at 8 o'clock, you're getting a boost in testosterone while you're sleeping. I'm like, is that super beneficial? We would rather see it dose close together. You get an even higher peak, but then it's a long enough period too in between that lunch and that breakfast dose where we'll see the endogenous LH and FSH come back because it's been far enough. It gives your body a chance to recoup.
Does it increase a person's hematocrit level? I mean, from what I hear, we're saying that
No,
it does not.
no, even in the studies, I think it was, it was like 1%, so it was like 1 or 2 patients out of the 160 or 180 patients.
But is that compared to other methods, or are you saying?
Yeah, so compared to injection, where you get like 30% of patients have issues, so polycythemia, so greatly reduced.
Because that's a big issue. People trying to find a place that will do the donations, right? With a scripted, therapeutic.
For sure.
Does it increase the risk of cardiovascular issues? And we're comparing this to other forms of testosterone. Blood pressure isn't.
No, so even in the studies, they tested it in patients that are already on hypertensive medications and patients with high diabetes, so our high risk patients. They tested it in, and they measured it. They had baselines from when they started, and then they continually checked it, but they had checkups at 4 months and 6 months. So even in those patients who were on hypertensive medications, it was 166 patients, and it was a percent change line. It changed by 3 points in their blood pressure over that 6-month period. So it wasn't a huge increase.
If it's not the Kyzatrex, I wonder what else is making your blood pressure elevated.
Oh, I've got a pretty good idea.
See, in patients with diabetes, it changed also a 3-point increase from baseline. So it's definitely not significant increase, but it was only 3 points in there. It's systolic and diastolic blood pressure changes.
Well, under what the FDA define as, clinically meaningful increase in hypertension or diabetes chances, Kyzatrex would be below that. So the safety profile is outstanding when you're looking at hypertension and diabetes.
Are there any other specific health conditions? That was one of the things that I think people are going to ask. If I have a certain condition, I'm not a candidate for Kyzatrex. Are there certain conditions that a person might have to where you're like, this just isn't going to be the right medication for you relative to other testosterone methods, right? I mean, if you're not going to have a prostate cancer and you're not going to do the injectable or the cream, then you really can't find it fair to say, well, that you can't, you can't single it out for things that the other forms have as well.
There's nothing added on to any other forms of testosterone. It's going to be the same.
So far, there's been no downside to this whatsoever. There's only been an upside.
Yeah, that's what we've had. Some providers who have been using it for a year and a half. He's like, I start everybody on it. Even if they're coming in looking for the injections, hey, let's try the oral one first, just because of the safety profile on it has been so good.
How's the absorption process when you come through the lymphatic system? How does it differ from oral testosterone that would go through, let's say, the digestive system, like the different pathway that it goes? How does that work from an overview?
Yeah, so when it gets absorbed either through the stomach or the small intestines, when it gets absorbed into the bloodstream, that blood first goes to the liver before it goes to any other tissues in the body. So as soon as it goes to the liver metabolizes it, and that's where we would have issues before. And it was specifically a methyl testosterone. This testosterone, one, it gets dissolved into the fat specifically, and that fat gets absorbed through the lymphatic system, which then bypasses that first pass metabolism through the liver.
Normally, when you eat something, it travels through your digestive system. And that's exactly what you want most of the time because it has to pass through your body's cleaning system, which is the liver. But when you take certain medications, you don't want your liver to clean them because your liver is like a 5-year-old in a china shop and it destroys everything. Not only that, but some medications can even hurt your liver. Well, the lymphatic system is like a secret tunnel that can be used to get medications where they need to go in the body. But it sneaks around your liver like a ninja.
And what happens if I miss my dose? Let's say I just space it and I forgot to take my dose, and so lunchtime, it's now 8, 9 o'clock at night. Do I take it then?
Yeah, I would say not to worry about it and start, the next morning. Patient's free testosterone is going to be going up. It's going to get absorbed into the tissues. You miss one dose, it's not the end of the world.
We don't have the data. Of course, we don't, because it's a brand new product. Everything started out like that. We don't have anything that says there's a red flag either, though, right? Like up until now, you have a few years of data that you're going off of. And so I'm not going to put words in your mouth, but is there anything within that they've identified as being a red flag, saying, okay, we might want to watch this, or has pretty much everything been equal to what you would get off of a different form of testosterone?
I would say probably even better, just because of the safety profiles that we've seen. I would say, probably, like I said, we don't have the data, but I would assume probably safer than doing injections, at least injections long term.
Started some research. There was another product, another Jatenzo. It looked like kind of a competitor sort of product. How does that, because I'm going to get that. I'm going to have people say there was a product out there. What's the difference between this product and that product, if any?
So it is similar product, but Kyzatrex has made their product much more fiscally available. They're not going the whole big insurance route like the Jatenzo, the super expensive. That company decided they wanted to go towards the insurance providers and traditional healthcare route, and Kyzatrex wanted to make it more affordable and go towards the masses.
Now, will you still need like an anastrozole or some aromatase inhibitor? I know we had talked about how it can keep that estrogen, the aromatization process down a little bit, because we are having steady levels. We're not just juicing it and then all of a sudden like an injection where my body's like, okay, I've got excess here, let's turn it into estrogen. So I'm not saying that they're never going to need it, but it seems like there would be like a lesser need for it in a lot of cases based upon the way that you kind of microdose this.
Exactly. A lot less need. Some patients may be a little more sensitive and high aromatizers, but most people don't need the need for an AI at all.
Okay, how about HCG or gonadorelin? I know we did talk about it from a boost kind of standpoint, because then your factory stays on instead of shutting off, because it, the negative feedback loop. And so you're going to get a boost with that. But is that going to just be a personal preference for HCG?
Well, I'll let Nick talk. I know he talks about some of the specific use cases where HCG would also still be beneficial. When specifically, would HCG be a good add-on with Kyzatrex in particular?
Yeah, good question. So I think the application of an FSH and LH mimetic in utilizing Kyzatrex, in addition to, augmenting spermatogenesis, are those guys that have, areas of sexual dysfunction where something like HCG can be beneficial, like lack of penile sensitivity, a reduction in strength and force of erections, ejaculatory volume. These things, utilizing an FSH and LH mimetic like HCG can be extremely beneficial, as a tool to improve those areas of sexual dysfunction. So in that case, utilizing something like HCG would be very beneficial.
So it can be added, but it seems to be more of a personal preference and what you're looking for in your goals and objectives. It's not like right now, it's almost like you kind of have to take it sort of thing. But
No.
this seems like it's more of a preference.
Yeah, they did measure, psychosexual surveys, and statistically, it's not going to be necessary, but it could be an option for some patients.
What are some of the key advantages of Kyzatrex? And over injections of topical gel. So if I go out there talking to people about Kyzatrex, I'm going to say, okay, yes, you get all the benefits of an injection cream, but here, in addition to that, these are the things that you're probably going to experience. Now, I know a lot of times there's no guarantee, but these are the things that the data shows happens in a majority of the population. What are some of those bullet point lists where you would come in and say, this is why you should do Kyzatrex over an injectable or cream?
So I think the first one would be the safety and efficacy when it comes to the erythrocytosis and polycythemia. With the decreased chances of that is a huge component of some of the concerns that we have with the injections. Also, when it comes to the LH and FSH, yeah, it's going to drop some with the Kyzatrex, but it's not going to go to zero. It's not going to tank like it does with the injection. So you're going to still have preserved some endogenous testosterone production. We're also not going to see that high conversion of estradiol, which was where we get some side effects and concerns with the injections when it comes to gynecomastia and other issues that high levels of estradiol in men can cause. As well, when it comes to it actually decreases SHBG, so you see the sex hormone binding globulin increasing free testosterone as well, which is a huge factor. There's no scar tissues from having to do injections for a long period of time. The creams, unfortunately, they can rub off on other patients. They're kind of messy. They're not preferred for a lot of people. You've been taking the Kyzatrex. How you been feeling on it?
I feel great. And I don't notice necessarily a difference, but I think not noticing a difference is a good thing, right? I don't notice that there's any difference in anything, which is kind of the objective here. I'm not going to know the blood pressure thing yet. I'm not going to know the hematocrit thing yet. None of those, because it's been a couple of weeks or so. So we're not going to know those values yet. But what I can tell you is I don't feel any different, no lesser, like no energy level changes. Nothing, as far as I can tell, has changed from the cream. To be honest with you, from the cream before, it was actually, for me, it was an improvement over the injections. I don't know why. Maybe my body does better with the cream, the absorption, what maybe because I was microdosing the cream, because I do that 2 times a day. So I had steadier testosterone levels, which again, this is going to do as well. I actually felt better off the cream than I did in the injectables. And I feel just as good on this. Then I can logically say, I'm going to feel better on this than I did on the injectables. I don't have any negative side effects. I don't get any sickness or nausea when I take the pills, which is, thing with people. Transportation with it, I like to travel a lot. The syringes and the medications and all the rest of that stuff becomes a real pain. All the benefits that I see from that, I've not come, and I've tried. Because if I go out there with something and I don't think about a negative and I put it out there and somebody comes back to me with a negative, I look like an idiot. One of my objectives is to not look like an idiot and try to think of everything that we possibly could and make sure we address it. Even if it is a negative, we at least addressed it as being a negative, and we were forthcoming about that. And we just gloss over it. So I haven't found anything yet that's a negative. I haven't experienced anything yet that's a negative. So I'm excited. I'm excited about it. As far as fertility goes, that's a common issue with men that are, let's say they're low 30s or something like that, and they just have, low T. They still want to have children. And so that whole fertility thing comes into be an issue. Is there any difference with Kyzatrex and the fertility side of it, or as opposed to the other methods, or is it about the same?
Because we don't see those tanks and LH and FSH, and that's what honestly they're studying it now to see how well sperm production is preserved while they take the Kyzatrex. So it's something they are studying. We're excited. They're going to probably release the data soon. But that's why maybe if you could want to do lower dosage and do enclomiphene or HCG in combination with it. Don't have a whole bunch of data on it, but it's something that hopefully soon we do have some. But that's what you can do lower dosage and do enclomiphene with it every other day or every day as well, and hopefully preserve some of that spermatogenesis while on Kyzatrex.
The data is pointing to some really, really good results here with Kyzatrex when compared to injectables, right? Just purely because of the side effect profile of the drug. One will just assume that will be your better option. I think the data will be out very soon, but it looks pretty promising to be a very good alternative.
Is there anything else you want to just say from your side?
Yeah, so I think the one thing we didn't hit on was checking your levels. We just want to make sure when patients do get their blood drawn, or your providers, when they're telling their patients to make sure they check it between 3 and 5 hours after the dose. That way to get an accurate representation of where their levels are. If you miss your dose first thing in the morning and you get done at 8 o'clock and you haven't taken your dose yet, your levels aren't, going to be where you're expecting. Then, yeah, the free test may be up because you've had your SH and your SHBG decrease on the Kyzatrex, but you're not going to see that C peak where a lot of people want to see where their number. I want to see that 900, so that's just a caveat to it.
So you said about 3 hours?
Between 3 and 5 hours after the dose.
Now, from a pharmacist standpoint, I just want to kind of, let everybody know that, we're pretty exciting as pharmacists to see, such a different option out there for us. And the reason why is, we've seen, and I'm a compounder, right? So I compound creams, I compound different alternative way of providing testosterone out there. And I have not seen anything like this yet. We used to do troches.
What's the negative on the troche? That's a great question. What is the negative on a troche? And what's the difference between those two delivery methods?
And that's the most important piece to it. The troche, on the troche, you don't have that delivery mechanism, right? You don't have that way to really truly bypass the liver. There's a few things missing. Here you have an encapsulation. The mechanism of the delivery system itself, the ways that they're encapsulating the testosterone, the different type of alcohol that it is, makes it perfect for absorption, which is basically the ability to provide the testosterone to the tissue, which you don't see on the regular troche. On the regular troche, all you're doing some propylene glycol. You're dumping, your testosterone powder into, and you're hoping for absorption in the stomach, which you don't see here with Kyzatrex. Kyzatrex, they go above and beyond with the delivery mechanism that no compounder can replicate. In order for you to replicate something like this, you really need to have an amazing facility. You need to actually get access to that alcohol as well. And it's not something you can easily get access to. From a pharmacy perspective, it is definitely innovation for us.
You see other things coming out with this delivery method? Can you see other things that are liver toxic coming up? I guess I'm asking, is this like a delivery mechanism that can be used with other things?
I think there's a lot of new other drugs coming out. We're going to be utilizing that same type of lipoprotein particle delivery mechanism, even in the world of peptides, really. And because at the end of the day, is I can encapsulate the drug itself and bring it to delivery to the site in which you want that drug to be dumped into, and then get absorbed, through the kinetic factor to the tissue. And that's very, very difficult to do. Here, they had a really awesome way to do this. But from my understanding, there's a lot more new drugs on the horizon that are coming out to be able to, encapsulate the drug and literally just protect it through the first pack effect, and then boom, deliver it right there when it needs to be delivered. More drugs coming out for sure, especially in the world of peptide, because that's the key, right? If you can actually get peptides to be absorbable by mouth, you don't have to inject them. Then you're changing the game.
Appreciate your time. Thanks so much. I think this is very informative. I think it's really going to get a lot of people to understand a little bit more about what this is instead of this, like fairy dot magical stuff. If we can break it down into scientific terms and let people understand, this is going to, okay, that kind of makes sense. That takes the fear away.
Time out, nap, finger painting. You know what you can do with your fingers? There's a new sheriff in town. Get with the program, or you and your homies might be lined in chalk.